In the aftermath of the outbreak of Ebola virus in 2014, there was urgent need to strengthen national and regional cross-sectional capacity for collaborative disease surveillance and epidemic preparedness in West Africa. Hence, the Regional Disease Surveillance System Enhancement (REDISSE) project was established in 2016. It aims to remedy the weaknesses of human and animal health systems that hinder effective disease surveillance and response, and in the event of emergency, provide immediate and effective response to same. REDISSE project is coordinated by the West Africa Health Organization (WAHO) and funded by the World Bank. It has 5 components: surveillance and health information, laboratory capacity building, preparedness and emergency response, human resource management for effective disease surveillance and preparedness against epidemics, institutional capacity building, project management, coordination and advocacy. The REDISSE project is so far being directly implemented in phases in 11 countries of ECOWAS and Mauritania, and now in its 3rd phase. To ensure a successful implementation of the project's activities, WAHO organized a series of meetings from 15 to 19 October 2018 in Lagos, Nigeria. The Technical Subcommittees meeting on 15 and 16 October 2018, which is set to precede the Regional Steering Committee meeting. The REDISSE Project Phases 1 and 2 restructuring meeting on 17 October 2018 to address some misalignment concerns between the regional and country's results frameworks. The Regional Steering Committee meeting on 18 October 2018 to review and adopt the report and recommendations of the Technical Subcommittees meeting, and Implementing Partners Annual Planning meeting on 19 October 2018 to seek synergy and complementarity between partner supports to participating countries. On Thursday, October 18, 2018, REDISSE 3rd Regional Steering Committee meeting was held at Radisson Blu Hotel, Ikeja, Lagos, Nigeria. It was attended by the World Bank and representatives of the implementing partners, the World Health Organization (WHO), World Organization for Animal Health (OIE), ECOWAS Regional Animal Health Center (RAHC), the Center for International Cooperation in Health and Development (CCISD), a Canadian not-for-profit corporation, and the Mero Foundation (FMX), a family foundation fighting infectious disease. Declaring the meeting open, the Director General of WAHO, Professor Stanley Okolo, said WAHO will strengthen advocacy towards the governments of countries that have not yet engaged in the process, with a view to securing their approval to sign for the project.
To date, although 11 of the expected 16 countries have so far subscribed to the REDISSE project, it's still beneficial to the entire West African region, given the many regional activities being promoted and supported. We must and will strengthen our advocacy towards the governments of countries that have not yet engaged in the process, with a view to securing their approval to sign for the project. And this with the sole aim of ensuring the existence of robust and resilient surveillance systems across the region, capable of preventing future epidemics, or where appropriate, providing an effective and timely response.
A senior health specialist at the World Bank, John Paul Clark, said the meetings afford WAHO and member states the opportunity to see both what is and what is not working well in planning and implementation of REDISSE 1 and 2.
I, of course, would like to see things going faster than they have gone, but I think that we have made some progress and we've had some innovation. I think one of the best examples of that is here in Nigeria, where REDISSE, within a week of it becoming effective, was mobilized to help address the Lassa fever outbreak in March of 2016. And I think that that was a good test of our ability to be resilient. But in terms of some of the other processes, some of them have taken long. It's a complicated project. It involves multiple ministries, and the planning processes and the discussions around putting the activities in place has been a little bit longer, I think, than ideal, but I think it's natural to understand that that would happen.
on REDISSE 3 and expectations from the meeting.
Well, I think this third meeting has given us quite a bit to think about and some very clear directions about how to move forward and how to improve the way that we are interacting as a group in order to achieve the same outcome. This meeting has looked very carefully at what people have done well, what we have not done well. And we're not just looking at the countries, we're also looking at the World Bank itself. We're looking at the West African Health Organization, and we're looking at the partners that we've engaged for the implementation of the regional program. And this meeting has come up with some observations on how we can all work better. And recommendations from the reading will be directed to the countries, to the West African Health Organization, and to the World Bank as well. So we're expected to make some changes in the way that we're engaging along with everyone else.
The DG WAHO, Professor Stanley Okolo, assessed the implementation of REDISSE 1 and 2.
In terms of the implementation, first of all, let's talk about the fact of the objective of REDISSE 1 and 2. It is to try and help us strengthen our epidemiological surveillance and also in order to help us with preparedness in terms of epidemics. And I think it has gone well in terms of the acceptance by countries that this is something that is required to be done, the recognition of the need for countries themselves to reinforce their preparedness and their capacity and communication. So that has gone well. I think what areas where we may need to improve more is in terms of implementation of the agreed activities within the countries. And so you find that it's those agreed activities that will progress us more towards achieving quality preparedness in all our individual countries.
On his expectations at the end of the 4 days meetings.
My expectations will be that countries will redouble their efforts in terms of performance, in terms of the activities. We will expect to see that not only in terms of when we look at the activities that have been completed, but also in terms of the performance of the budgets, so that we will see that they are getting closer to it. Of course, the ultimate objective and the ultimate test is when these countries now have a new joint external evaluation, what is called JEE, of their preparedness in terms of integrated disease surveillance and response strategy, that we will see that a lot more of our countries are moving out from the red assessment that they have had over the past 2 years.
The Regional Steering Committee meeting was preceded by the meeting of the Technical Subcommittee, which evaluated the status of implementation of the recommendations of the Regional Steering Committee meeting held in Ouagadougou on 26 January 2018. Review the status of implementation of countries and WAHO's 2018 Annual Budgeted Work Plan and Procurement Plans. Analyze the WAHO, the countries, and implementing partners' 2019 Annual Work Plans and Procurement Plans and made recommendations to be submitted to the Regional Steering Committee for approval. This was followed by the Restructuring Committee meeting on Wednesday, with a target to contribute to the effective implementation of the project through proposals for appropriate solutions to the various shortcomings identified following the implementation of the project to date. Participants from Nigeria, Gambia, and Guinea-Bissau speak.
But we have to go build our health security. That is what World Bank is interested in, and also for us to make sure that our system is resilient. That if anything comes, we are able to respond properly. So we don't have to wait. We don't have to fold our hands till we have issues. We can get prepared for any eventualities. That's what interests World Bank. They are more interested in you using the money to achieve the purpose, and that is why I'm sure they're interested in the restructuring meeting.
This gathering is meant to strengthen the capacity of the member states of the ECOWAS countries in trying to build resilience in their public health practices.
I think this is a good opportunity to be restructure the project, the activities, the different activity for the different countries, to sharing experience about our difficult issues, to implementing the project.
The meetings were rounded up by the 2019 REDISSE Implementing Partners and Agencies Joint Planning Meeting on Friday, 19 October 2018. Partner institutions represented at the meeting were the World Bank, World Health Organization (WHO), World Organization for Animal Health (OIE), Food and Agriculture Organization (FAO), the Center for International Cooperation in Health and Development (CCISD), the Mero Foundation (FMX), the Regional Animal Health Center (RAHC), the University of Ghana and the University of Ouagadougou, which run the Field Epidemiology and Laboratory Training Program (FELTP). Representative of the World Organization for Animal Health (OIE) speaks.
The bottom line is really to strengthen veterinary services in particular, so that they can meet the obligation regarding early warning, regarding early detection of any outbreaks. As you know, many human diseases are coming from animals.
At the end of the 4 days meetings, WAHO Director of Public Health, Dr. Carlos Brito, says WAHO's expectations have been met.
We did a lot of improvement in what is necessary to be done, for example, to improve the coordination, to improve our collaboration, specifically in the One Health approach, which is very difficult to be done in our context. We discuss and we decide about activities to be implemented, supporting countries, namely in technical assistance to our member states. So I think we decide a lot of important things which are objective of this meeting. It was possible for us also to define deadlines and results to be achieved. And this is also important for ECOWAS and WAHO, West African Health Organization, to have in the understanding with our partners deadlines and results to be achieved, appropriate monitoring and evaluation of the evolution of our activities.